Okay. Among the 8 extra meridians, only the Ren and the Du meridians have their own points. All the other meridians flow through regular meridians, cutting through them and sharing common points with these meridians. The Yang motility meridian flows mainly on the lateral side of the body and cuts through many Yang meridians. Its function is to keep the general Yang energies of the body moving into the general Yin energies of the body. So the common points of the Yang motility meridian are the following: UB61, bladder 62, and bladder 59. We can find this on the foot or the heel. So we also have GB29 on the inguinal area, SI10, LI15, and LI16. And then we have stomach 4, 3, and 1 on the face, and bladder 1 and GB20 at the neck. Bladder 1 is near the eye. The confluent point of the Yang motility meridian or the Yang Qiao Mai is UB62. Okay. So now we'll go to Yin motility or the Yin Qiao meridian. This meridian flows on the medial side of the leg onto the ventral side of the body and meets the Yang motility meridian at the feet and at point bladder 1 in the face. It cuts across and has common points with Yin meridians. Its function is to keep the general yin energies of the body in motion and moving towards the general Yang energies of the body. Among the common points here are kidney 6, kidney 8, bladder 1, and the confluent point is kidney 6. Okay. Here is an illustration of the flow of the Yin motility and the Yang motility meridian, starting from the foot to the eye at point bladder 1. Okay. The Yang motility meridians flows usually in the right side, the Yin motility meridians on the left. Okay. Next. But in practice, this is not observed so strictly. The Yang motility meridian is used in any case where the patient is hot, restless, has many Yang dominant pains or skin problems, spastic paralysis, or burning sensation. In these cases, the confluent point of bladder 62 is used. If any particular organ suffers from Yang dominant symptoms and it shares a common point with the Yang motility meridian, this common point could be used as well. For instance, point stomach 3 or 4 could be added to bladder 62 in case of gastritis with acid reflux. The Yin motility is used in general tiredness, dullness, coldness, or weakness, flaccid paralysis, and numbness. In these cases, point kidney 6 is also used. This is the reason why point bladder 62 is a tranquilizing point and kidney 6 is referred to as the wake-up point. Bladder 62 moves the Yang into the Yin, thus increasing the Yin and reducing the Yang. Point kidney 6 moves the Yin into the Yang and thus reducing Yin and increasing the Yang. Okay. Another very important use of the Yin and Yang motility meridians is that they are used to balance the left and the right sides of the body. Often we see patients complaining of one-sided problems such as pain on all of one side or weakness on one side. If the problem on one side was of a Yang nature, then point bladder 62, the confluent point of yang motility, could be used on the affected side to move the yang energies from the excess side to the deficient side. In hemiplegia of a spastic nature, point UB62 can be used on the side of the paralysis. If the one-sided symptoms are of a yin nature, then point kidney 6 of the yin motility meridian may be used, again on the yin side only.